Good evening. My name is Ashley Apple, and I am a mom to 2 children in the Midlothian district. I'm a board-certified family nurse practitioner with a doctorate in my field. I work in pediatric urgent care, and like you, I take the safety, health, and well-being of children very seriously. A study by the Virginia Department of Health found that 40% of transgender Virginians have been physically assaulted, and the median age for their first assault was 16 years old. 27% report being sexually assaulted, with 80% of those reporting multiple sexual assaults with median ages of 14 and 15 years old. 1 in 4 transgender Virginians reported at least one suicide attempt, with median ages being 15 and 16 years old for the first attempt. Transgender adolescents are at significantly increased risk for multiple episodes of violence victimization and mental health challenges, and studies have repeatedly identified social stigma as one of the biggest contributing factors. The American Academy of Pediatrics states, if a mental health issue exists, it most often stems from stigma and negative experiences rather than being intrinsic to the child. At the structural level, stigma is perpetuated by policies and enforcement practices that reject a person's inherent identity or excludes them from full participation in the fundamental activities of daily life. Peer support and inclusion are fundamental needs during the developmental stages of adolescence. So when structurally based rejection and exclusion occur during this time period, the impact is profound. Evidence consistently shows that when transgender adolescents are supported and their gender identities are affirmed by developmental structures such as families, peers, and schools, the risk for violence victimization significantly decreases. Overall educational achievement improves, and the prevalence of mental health problems is reduced to the same level seen among their cisgender peers. Supportive measures in schools can include being respectful, using students' preferred names and pronouns, and allowing them to access facilities and play team sports that align with their gender identity. Gender affirmative care and support is endorsed by the American Medical Association, the American Academy of Pediatrics, the American Nurses Association, and the list goes on and on. During the process of medical decision-making, we consider the benefits versus risks of any given treatment or intervention in order to provide the best possible care for patients and communities. So let me be clear. There's no evidence to suggest that these supportive measures pose any risk to the health or well-being of any students, and these actions can be quite literally life-saving for transgender students. While on the subject of benefit versus risk, I would also like to point out that for the overwhelming majority of children, wearing a mask in school poses no risk to their health, and this simple intervention can be potentially life-saving for everyone in the building. I have a neuromuscular disease. I wear a mask for 10 to 12 hours a day as I take care of COVID-positive children. It is not the role of the school board to promote any specific religious or political ideology, but it is your obligation to ensure the physical and emotional well-being of all students attending school in Chesterfield County. And with that in mind, I hope you listen to science and listen to the experts who have dedicated their lives to this.